Welcome to my YouTube channel. It's Sister Annabelle Enes from Zambia. If you're a returning subscriber, I say thank you so much for returning. And if you're a new subscriber, I say thank you so much for subscribing to this channel. And if you're just watching me, you've not yet subscribed to this channel, please, I beg you to subscribe to this channel, turn on your notification bells, like it if you love the presentation, and drop comments if you have any questions for me or any clarity, or you want me to present a certain condition. This channel is created for us to know condition. If you're a student, I can promise you this channel is well benefited. So without wasting your time, today we are going to talk about pneumonia. Yes, we're going to discuss pneumonia. I know we've heard about pneumonia. We've seen patients who are suffering with pneumonia or who have suffered with pneumonia before. So today we want to discuss pneumonia. We're going to say the definition in general, then we're going to say the classification, the causative organism, then we're going to talk about the two pathophysiology in bronchopneumonia and lobar pneumonia. Then we're going to say the signs and symptoms. We're going to say the investigation. Then we're going to treat this patient with pneumonia. Then we are going to say the complications and the aims for nursing care plan or nursing in general. So I want you to stay tuned, please. I want you to watch this video up to the end. So we are going to begin. Definition: pneumonia is an inflammation of the lung parenchyma tissue characterized by cough, chest pain, dyspnea, fever. Usually it is due to bacteria, fungal, or viral infection. So pneumonia is an inflammation of the lung tissue characterized by a cough, chest pain, dyspnea, fever, usually caused by bacteria, viruses, and the fungal infection. So that is pneumonia. Classification: you can classify pneumonia in two segments, which is the anatomical segment and the causative segment. So anatomical structure, it is caused in the bronchial. There is bronchopneumonia and there is a lobar pneumonia. So bronchopneumonia, it affects the bronchi, and lobar pneumonia affects the lobes of the liver. So that's the classification. Then the causative organism, classification according to the causative organism, we have aspiration pneumonia, which is due to inhalation of food, fluid, yes, vomiters into the airway, which can lead to pneumonia. And then we have epistatic pneumonia due to immobilization, like people or patients who are confined to bed. Yeah, they are predisposed to have pneumonia. And then we have atypical pneumonia caused by less common organisms from the environment, yes, which can be bacteria, viral, or fungi. Yes, fungal infections can also cause a pneumonia. Then on the same causative organism, bacteria, some bacteria that commonly cause pneumonia. We have Haemophilus influenza, we have Streptococcus pneumoniae. These can cause pneumonia. On viruses, we have adenoviruses, we have influenza viruses. These can cause pneumonia. And then we have pneumonistic carrying on the fungi. That one can cause pneumonia. And then we have on the protozoa, we have Mycoplasma pneumoniae. This Mycoplasma pneumoniae can also cause pneumonia. So on the predisposing factor, we have chronic bronchitis. So those people who have bronchitis, so when it is prolonged, it can lead to pneumonia. We have viral infections such as measles, which affects the respiratory tract and reduces the immunity system. So infections like measles can lead to pneumonia. So we have inhalation of foreign body materials into the respiratory tract. So inhalation of foreign bodies into the respiratory tract can cause pneumonia. These foreign bodies can be food, fluids, or any chemicals. It can lead to pneumonia. Then we also have obstructions in the respiratory tract, like cancer. A growth is growing in the respiratory tract, causing the obstruction, which leads to retention of fluid and secretions in the lung tissue. It can cause pneumonia. And then we have prolonged cold, like someone has a cold for a long time, yes, which irritates the respiratory tract and reduces the ability of the cilia to expel the foreign bodies and microorganisms. So this prolonged cough can also cause pneumonia. Then we have on the types of pneumonia. Yes, so we've classified. So according to the classification on the bronchopneumonia, so bronchopneumonia, this is an inflammation of the lung occurring with patches in the patches around the affected tenobronchial, or it may be confined into a small segment of the lung. So it can be maybe just a patch on the lung, on the bronchi, that's bronchopneumonia, or on the segment, it can be confined in a small segment of the lungs, and it can spread widely to other parts of the lungs. So that is in bronchopneumonia. It is usually result from secondary to other infections, e.g. measles, aspiration of oral pharyngeal materials in the airway. So bronchopneumonia, it comes as a secondary to other infections. So I'm going to read through the pathophysiology of bronchopneumonia. Yes, I hope you understand. So you can get your paper, get your pen, and then jot down something that will make you remember easily during an exam, or for general knowledge. You can know what happens when someone comes with the bronchopneumonia, or when you take a relative to the hospital and the doctor tells you to say this patient has bronchopneumonia. So I'm going to say the pathophysiology is what happens in the body with the bronchopneumonia. So I'm going to read through, so pay attention. So the invading of organisms in the alveoli provokes the overly exuberant immune response to the lungs. The small blood vessels, which are capillaries, becomes leaky, and protein-rich fluid seeps into the alveoli. This results in less functional area for oxygen and carbon dioxide exchange in the alveoli. The patient becomes relatively oxygen deprived while retaining potentially damaging carbon dioxide. The patient breathes faster and faster in the efforts to bring more oxygen and to exhale more carbon dioxide. Mucus production is increased, and the leaky capillaries may engage to mucus with blood. Mucus plugs actually further decreases the efficiency of gaseous exchange in the lungs. The alveoli will fill up with the fluid and debris from the large number of white blood cells being produced to fight the infection. Consolidation, a feature of bacterial pneumonia, occurs when the alveoli, which are normally hollow air spaces within the lungs, instead become solid due to quantities of fluids and debris. Okay, so let me explain a bit. So in the bronchopneumonia, what happens is when the bacteria invades the lung, it provokes the immune response. So there will be white blood cells released into the alveoli to fight the infection. So when white blood cells are released, then there will be inflammatory process which will lead to swelling of the alveoli. When the swelling, the redness, the pain comes in, then there will be impaired gaseous exchange in the alveoli. So which will lead to accumulation of fluid, and the patient will present with the difficulty in breathing. Literally, that's what happens when there's impaired gaseous exchange. So that is in bronchopneumonia. So now I'm going to read about lobe pneumonia. What happens in the lobar pneumonia? So lobar pneumonia is a type of pneumonia that may be confined into the lobe. So lobar pneumonia is a type of pneumonia that can be confined into the lobe. The inflammation of the lobe pneumonia can affect the lobe and the alveoli, can affect the lobe. The alveoli does not contain significant fluid, but only protein-rich hyaline membranes. So in the lobe pneumonia, it's not mainly with the alveoli, but it's with the lobes. So I'm going to read through the pathophysiology of lobar pneumonia. I want you to pay attention. I've tried to summarize it in a way that will be easy to understand. So I start the pathophysiology of lobar pneumonia. When the organism reaches the lung, it will trigger immune response, especially with the neutrophils, which engulf the organism and release the cytokines, which causes inflammatory reaction. The lung becomes hyperemic and the capillaries becomes highly permeable for fluids to seep in intravascular spaces into the tissue and alveoli. This leads to the space of gaseous exchange. This reduces the space of gaseous exchange, thereby causing impaired ventilation. The congestion in the affected area of the lungs and the alveoli. So it leads to congestion in the affected area of the lung and the alveoli. So on the lung and the alveoli there will be congestion in the lung and the alveoli. So when you have lobar pneumonia, the first day you start feeling the congestion in the lung and in the alveoli. On the second and the third day, the lung will appear red and hard like a liver. Hence, this stage is called hepatization. Hepatization characterized by the presence of erythrocytes and neutrophils, epithelial cells, and fibrins in the lungs. Then after a while, hyperemia will subside, but the lung will remain hard and appears gray. Hence, the gray appearance of the lung is called gray hepatization, which occurs on day 4 and 6 day following the infection. In this stage, the lung is gray-brown yellowish because of the fibrin purulent exudates disintegration of the red blood cells. The final stage of resolution is characterized by the reabsorption and restoration of the pulmonary architecture. The fibrous inflammation may extend to and cross the pleural space, causing a rub head by auscultation, and it may lead to resolution to the organization of the pleural adhesion. So what happens in here when it reaches the microorganism reaches the lung, the immune response, the body will respond to release the neutrophils, the erythrocytes to fight infection, and then the presence of the neutrophils, the erythrocytes, all these will cause the reddish side, and then when the healing process starts, the lung will appear gray, which is on the day 4 and day 5. Yeah, so read clearly, that's what happens in the lobar pneumonia. So having said the signs and symptoms of lobar pneumonia and bronchial pneumonia, having defined and said the pathophysiology of lobar pneumonia and bronchial pneumonia, we're going to say the signs and symptoms in general for pneumonia, which is in lobar pneumonia and the bronchial pneumonia. So signs and symptoms, there will be productive cough due to irritation and the inflammatory process. There can be nasal flaring due to poor ventilation. There will be dyspnea due to poor ventilation as a result of inflammation in the lungs. So there can also be cyanosis due to hypoxia. There will be chest pain, which is a stabbing pain, stabbing in nature due to inflammatory process in the lung and the pleura. There will be fever due to infection. There can be intercostal retraction due to impaired ventilation. There can be what else? There can be nausea and vomiting due to the GIT involvement. There can be headache due to cerebral hypoxia. There can be anorexia due to inflammatory process. There can be joint pain and muscle pain due to tissue hypoxia. Then there can be hemostasis due to the rupture of the blood vessels. So if you see all these signs, they are signs of pneumonia. So diagnosis, how are we going to diagnose the patient? So we are going to do history taking, which will review the stabbing of the chest pain, the stabbing in the chest, of the chest pain, which will be worse when the patient take a deep breath or when the patient coughs. So the patient will tell you to say, I'm having a sharp pain if I take a deep breath, or I'm having a sharp pain if I cough. So you rule out pneumonia. Then on auscultation, there will be reduced air entry and cracking sounds and in the affected lungs. So there will be reduced air entry and the cracking sounds into the affected area. On percussion, there will be dullness on the affected side due to consolidation. Then you can also do sputum for microscopic culture and sensitivity to rule out the causative organism or causative agent. Then we can do FBC, which is full blood count. We concentrate on the white blood cells, and then there will be elevated leukocytes. Yes. Then we can also do blood culture, which will review the causative agent, which is if the bacteremia is present. Then we can do X-ray. Yes, we can do chest X-ray, which will show the opacity. Yeah, which will show the opacity. And then this is seen with white patches. So you do X-ray to show the opacity. On the X-ray, it is seen as white patches. Then we can also do computerized tomography, which will show pneumonia even where X-ray cannot see. So those are the investigations that you do with people who are having pneumonia. Then treatment, we are going to treat this patient. We can give antibacterial drugs. Yes, so antibiotics, we can give the penicillins. Yes, but be caution to people who are allergic to penicillins. Then we can give analgesic. We can analgesic, which is paracetamol. We can give antipyretic to deal with fever. Yes, which is also paracetamol. Then we can do oxygen therapy if the patient is having severe difficulty in breathing. So we can give oxygen therapy. Then we can give salbutamol. If the causative organism is fungal, we can give antifungal, yes, which is fluconazole. Then we can give bronchodilators, which is Ventolin, yes. Then we can encourage the patient to take a balanced diet to boost the immunity, thereby promoting recovery. recovery. So we can also give a lot of fluids, all of fluids, yes, to loosen up secretions, thereby bringing the sputum on the upper side so that the patient can cough them out. So that is the treatment. And then the complications of pneumonia, they can be empyema, septicemia, abscess, pleural effusion. Yes, so those are some of the complications due to pneumonia. Then the nursing care. So your nursing care, as a nurse, you should aim to relieve pain, then to promote recovery, to prevent septicemia, to allay anxiety. Then you can also educate the patient about his condition. Then you can promote a good nutrition status, thereby promoting recovery. And then nursing management, general nursing management, we can do a propneuma, which is the environment, the positioning of the patient, rest, observation, psychological care, hygiene, elimination, nutritional status, the exercises of the patient, medication, and advice on discharge, which I'm going to do on the next video. We are going to discuss what you're supposed to write under these headings of a propneuma. A propneuma is an acronym made for general nursing management. So that's all for today. It's Sister Annabelle. Don't forget to subscribe. Don't forget to like it. Don't forget to turn on your notification bells. Don't forget to drop comments if you have enjoyed this presentation or it has been helpful to you. If you need any question, please drop comments. If you are enjoying my presentation, drop comments. So from me to you, it's bye and God bless you.